Okay. Seva, can you share do you want to try sharing your screen before we start, before I let people in, because it's 8:01?
Yeah, I just go ahead, Gail. It'll be fine.
Okay.
I just need to give it a swap. Okay. All right. Go for it.
Because I'll share my screen in just a moment. Hello, everybody. Okay, so Stava, you're a draw in the crowd. Hello, hello.
Hello, everyone.
Hi.
Greetings.
Glad to see you all. I have two people in the waiting room that have been joining for the longest time, so I hope that that's going to work for them. Okay, so I'm going to go ahead and start my share. And as usual, there you go. Okay. Bella, would you like to start?
I don't see, I'm not seeing the screen.
Hang on, everybody. I've got technical difficulties. No matter how much we try to work this out beforehand.
Okay, now I see your screen.
Okay.
Awesome, wonderful.
Very good. Okay,
Yeah.
thank you so much. Sorry for the technical difficulties.
Greetings, everyone, and welcome to the National Ayurvedic Medical Association with the Student Mingle hosted by the NAMA Student Subcommittee. I am Vela Catania, your host for this evening and chair to the Student Subcommittee, and I'd like to introduce Melissa Zegley, who is the vice chair of the Student Subcommittee, and I would also like to introduce Gail Nass, who is NAMA's membership director.
Hi, everybody. And yes, we do have, if my slide will advance now. There we go. Okay, so we are NAMA, the National Ayurvedic Medical Association, and represents the Ayurvedic profession in the United States of America. Our mission is to preserve, protect, promote, and advance the consciousness-based philosophy, knowledge, science, and practice of Ayurveda for the benefit of all beings. We do have a diversity, equity, and inclusion statement. In keeping with the spirit of Ayurveda, NAMA stands in support of all communities that make up our diverse nation and world. The safety, inclusion, and well-being of our entire community is intrinsic to our mission. We are committing to fostering a culture of diversity, inclusion, equity, anti-racism, cultural competence among our leadership, staff, and members. All NAMA programs and sessions are presented for informational purposes only and are not intended to provide or to be a substitute for medical advice, diagnosis, treatment, or prescribing. Always consult a physician before altering or discontinuing any current medication, treatment, or care. The mention of any product or service during any program is not intended to indicate or imply that NAMA recommends, endorses, supports, sponsors, or is any way affiliated or associated with the product or service. The opinions expressed in this program are the speaker's own and do not reflect the views of NAMA. NAMA does not accept any responsibility or liability for the accuracy, content, legality, completeness of any credentials, claims, or information that may be included in the presenter bios. If you are a professional and you would like one PACE credit for this presentation, please request that in the chat with your name, your member number, and the level of certification. And for membership inquiries and or to join the student subcommittee, because we're always looking for members. Student subcommittee is the one committee at NAMA who has a higher turnover because students graduate. So we're always looking for other student subcommittee members. So please contact me at that address. And then if you have any PACE inquiries, that is Seva Van Nooy's address as well. And I'm not advancing. There we go. Okay, we have quite a number of different upcoming events coming up. We've got the Art of Balancing Self and Work on August 26th. On September 9th, we've got our professional mingle, which has got, we'll be talking about Ayurveda for Women by Robert Svoboda. And so that's our Literary Insight series is something new for the professional mingles. Then we have another SIA in Ayurvedic elder home care. And then Seva is also going to be doing a PACE orientation coming up on October 9th. Bella, back to you.
Thank you, Jill. So our next student mingle is December 9th, 2024 of this year, and is the last one for this year. And it is with Kim Povey, Harmony Within, where she discusses integrating ancient wisdom and modern psychology. This evening, our mingle is focused on Ayurvedic massage and body work. I'm now having the great honor of introducing you to our speaker for the evening, which is Seva Van Nooy, who is a passionate and perpetual student of Ayurveda and higher learning for the last 25 years. She runs a successful Ayurvedic lifestyle consulting practice involving Ayurvedic body therapies as her special niche. Seva is a retired midwife, a holistic educator, Ayurvedic body therapy instructor, and has held staff positions at the Chopra Center, Optimum Health Institute, and California College of Ayurveda. She is the author of the Ayurveda Spa Therapy Manual, Do Basti Manual, and founder of Seva Ayurveda Academy, where she offers certification in Ayurvedic bodywork technician and Marma therapy. You can find her at www.sevaayurveda.com. And let's give a warm welcome this evening to Seva. Thank you very
Hi.
much.
Sorry, my lighting is so awkward. It's dark here because I'm on the East Coast, so don't have much to work with. But hi, thank you all for being here. Especially as students, it's such a precious place to be in your life and in your journey. And as you might have learned already, once you start your education with Ayurveda, then you just become a perpetual student and you just want to learn everything. And it's exciting that there's so much under the umbrella to really get into and to create a niche out of. But also, you know, you could have many niches too. But just don't get into the trap of wanting to do everything, because it can be very exhausting and that can get you overwhelmed, just trying to manage every component of working with your clients. So I want to share with you, those of you who are inspired to become body therapists, maybe this is your path. Maybe you will find a way to kind of be the consultant and the body therapist. Or you are going to be a practitioner that recommends the treatments and sends referrals to somebody. So I did find that in the Ayurvedic community, a lot of people weren't able to find people to do treatments for them, or there was, maybe there was a practitioner or a doctor and they hired a massage therapist to do the treatments for them, but still that therapist doesn't really understand everything they should about being an Ayurvedic body therapist. So that's kind of why I created the courses for those who actually want to be certified in it. It's really such a growing modality and in really high demand. So let's see, I'm just going to make sure I have my thing going. Yeah, so it's very valuable for anybody to take it on, because it's such a great need. So please tell me if you see that lovely screen.
I do.
Okay, you see my face and my things.
Mhm.
Okay, and thank you for that great introduction. It's very thorough. So that's that. And then if I go from there, so let's just get into it because we have limited time. And I want to share so much with you, obviously. So with Abhyanga, I'm just going to squeeze down my Zoom window too. Abhyanga. So hopefully you're all at a point in your training where this has been brought up. And actually, I do want this to be in the realm of discussion as well. Like, I will open up for Q&A, but I want you to start thinking about, questions you may have if you want to pursue this on your own, or if you want to just be somebody who is able to refer these out. What does it mean to put that into your client's program, right? Or their regimen. So in Ayurvedic curriculum, they do teach you about these treatments and what they're good for, like the benefits and the contraindications, and I'll share that with you too. But hopefully you'll have a deeper understanding of like how to really not prescribe, but like recommend these treatments to your clients. So this might be a little bit of a review, but hopefully you'll learn new things as well. Beginning with Abhyanga, so this is just two Sanskrit words, Abhyanga, which really just means oil rubbing. And it's always oil with Ayurveda. It's never lotions or creams. We definitely use oil because I'll share with you why, and you probably already have learned why oil is so important. But can anybody tell me what sneha means? And you could just I can't see you, so if you can unmute and just
You can just
shout it up.
unmute yourselves if anybody knows anything.
Yeah,
Sneha means oleation.
it does mean oleation. But as we know in Sanskrit, there is more than one meaning to the word. So sneha also means, or snehana, it's a Sanskrit for maternal love and affection. So it's this oil, but it's also means maternal love and affection. And the Ayurvedic proverb says, oil to the body is like love to the soul. And the suggestion here is that your oil massage, whether it's within self-care or it's performed to a client, that we would do this with the intention of affection and care and even love for ourselves, to ourselves, and then to our clients. And when this happens, whether it's a self-massage or you're giving it, this affection triggers the release of the body's loving, giving, and bonding hormone called oxytocin, right? So this is that feel-good, yummy hormone. And it's the combination of massaging the body with, it could just be warm oil. So it's always going to be warm, right? Because that's more penetrating. But sometimes it might be recommended to even include herbs into those oils, depending on the therapeutic effect that you wanted to create. So my hope is that, and what I really, really love about Ayurvedic body therapies is that it's not, they have a way to modify every single one for self-care. So you would be educating your clients on how to do that for themselves. And if you are a therapist, you're giving them these treatments, but also saying, you could do this at home, because self-care is is so important to help everyone cultivate a really beautiful, loving self-care practice. And statistically, when we have these self-care routines, then that's about 60% of our preventative health care. 60%. And that's a statistic that is done in research through Ayurvedic studies that I've gone through. And I really believe it, even for my own self, that it is really that powerful in prevention. So a warm oil massage, imparting love, compassion, and nourishment. And this sensation, it's just very deeply nourishing, also because of the way it's choreographed. And it supports profound healing on every level of our being. So mind, body, spirit, right? And even beyond that, with Ayurveda, we know everything goes so very deep. So specifically, this warm oil gets rubbed in or massaged into the skin in such a way that it can penetrate the deep tissue layers and bind to loosened toxins. So the loosened up toxins that we've loosened up through the massage bind to the oil and then get driven to the gut for elimination. So that's the whole goal of this Abhyanga treatment, is to loosen toxins, help kind of a gentle detox, and we're also stimulating and moving the lymph, and we are also targeting the nervous system. How are we targeting the nervous system with Snehana? Anybody? Abhyanga targets the nervous system because our entire skin is an organ, right? But there's hundreds and hundreds, and if not more, nerve endings on our skin. So what dosha is directly connected to the nervous system?
The responses in the chat are Vata. It's Vata pacifier.
Okay, thank you, because I can't see it. So if
Yes.
anybody just wants to yell something out, then that would be amazing. So that's right, Vata. So this is the number one antidote for balancing Vata, is warm oil application. The warmth, right? We're balancing Vata's cold. The oil, we're balancing Kapha's rough, Vata's rough, and unctuous. So it's smooth, right? So heavy, warm, smooth. This is all the antidote, because it's the balancing effect of an imbalanced Vata. And then even the way the Abhyanga is sequenced, it's the way it's choreographed, whether it's one therapist or two, is directly connected to balancing the flow of energies in the body. So Vatas, Vayus, and we're going to get into all of that. So balancing the proper flow of blood and lymph, encouraging quick removal of metabolic wastes, and then again, once those wastes are loosened, the ama, then they'll bind to the oil, and it will be like the oil's like a lubricating smooth track through the channels into the GI tract for elimination. So that's the goal and our intention as well. So just a short list, and I will be providing the slides for you in the chat at the end. So in a PDF form. So we'll just let you look at this quick list of benefits. So very stimulating, nourishing, and we're also lubricating the joints and tissues. So providing a lot of lubrication into the joints. Vata can get into the joints, and you'll hear some cracking or popping in the neck or the knees or the wrists. And that is an indication of just like air, right? That popping, cracking. So bringing in a lot of warm lubrication into the joints really helps to lubricate them and prevent the dryness that's causing all that cracking. Okay, so one more fun fact is that from the Charaka Samhita, the ancient Ayurvedic text, Snehana is said to be like a pot smeared with oil. So impurities, so if there's something, if there's a pot and it's coated with oil, then anything that goes on to the pot will stick to the oil. and be able to be delivered for elimination. So this will help protect our tissues, and especially, mucous membranes and any kind of area that is prone to dryness. It'll protect it so that impurities cannot stick to those tissues. And in the same way, if the body is properly and consistently oiled, then impurities cannot penetrate and disease cannot ensue. So that's definitely why there would be that statistic of the 60% preventative, right? Because we're helping to get the impurities out. So indications. So if you're seeing a client and they're complaining about any of these things here on this list, then you could say, I would really like you to get seen for an Abhyanga. You're welcome to do it on your own, and this is how you would do it. But if you would like to see somebody, and hopefully in your area you can find one. If not, hopefully I can help train one up for you. But yeah, joint care, postpartum, even pregnancy, it's fine. We just wouldn't want to move too much lymph. We wouldn't want to cause too much of a detoxification effect, but we would just really want to care for the joints and tissues of the pregnant mom. So any contraindications, heavy congestion, obesity, you can imagine if somebody's already congested or if there's a lot of thick, dense tissues, then maybe oil is not the best thing to put on top of that, because we'd want to clear that first. If somebody is experiencing anything kind of in the acute realm, which is most of these conditions here, we just wouldn't want to aggravate that. That's why with menstruation, it's more on the heavier days when your body's already kind of going through a purification. Abhyanga is very tonifying. So when we're going through a purification process in our own body, then we just want to let our bodies do what they do and not disrupt that purification process during our heavy times. So a short list of some oils, and it is always oil, and this is why, because oils are food for our skin. They feed the microbiome of the skin. Depending on the oil and the doshic qualities, we would ask the therapist to use certain oils. So almond is really good for vata pitta, and it's also good for the kidney, lungs, nourishing the skin and muscle tissues. It helps relieve pain and tension. Same with castor. It's really good for inflammation, reducing toxins, stiffness in the muscles. You've probably heard of castor oil packs, often done on the liver for doing liver cleansing. Very, very amazing. Castor is just so good for so many things, and even hair growth and just so many things, but it is very heating. So we want to use it more for vata. And keep in mind too, there's ways that we can combine these oils to make them appropriate for your client and for their needs at the time of their treatment. Coconut is great for pittas because it's cooling. It's really good for any kind of heating skin conditions that a pitta might experience, or an imbalanced pitta of psoriasis, eczema, or burns. It's also antifungal, antiviral, and antibacterial. Ghee, we know, is tridoshic for the most part, and a rejuvenator. I'm just going to kind of nutshell this as we go. Mustard for kapha, it's kind of hard to find. You could probably find it in some Indian grocery stores, but I don't know the purity of it. It's really hard to find, and I rarely use it. But there is ways to find it if you really, really believe that you need it, and it's the best thing for the client. I believe I got it from the Ayurveda Experience, which is a kind of a popular Ayurveda product company from India. So let's go to sesame oil, because sesame oil is really the one that stands out among the rest here, because all the qualities of this oil are able to penetrate to the deepest tissue layers. And if you've studied your physiology, then in anatomy, then your skin, we don't just have, all these layers of skin, but then we've got all these layers of tissues, right? We've got the dhatus, the 7 dhatus. So it penetrates all through all of those layers, and it's like a magnet for toxins. it really does magnetize and draw them out. And I'm talking about especially the fat soluble toxins too, which get lodged in different places. And so we really want to bring those out. The sesame really helps draw those toxins out, and especially with the massage, the Abhyanga massage, moving the lymph and the friction strokes that we're doing just help loosen things up. And then everything gets brought into the oil, and then the oil really does deliver that in for elimination. Sesame and sunflower are a very common combination, so a 1-to-1 combination to offer a safe tridoshic oil for a massage. If you are going to be a therapist or refer your clients to one, please make sure that they do a thorough intake form, though, to make sure there is no allergies to anything that they would want to use as an oil. So some people might have coconut oil allergies, some people might have sesame or sunflower, some people do have those nut allergies, and so forth. So please make sure you do have a thorough intake before you start prescribing oils, recommending oils. But sesame and sunflower, using just sesame alone on a body, it's pretty thick, even when it's warm. So I do like to add a little sunflower oil because it just creates this really nice glide in the massage. So prime carrier oils for even making herbal oils. You can use all of these oils for carrier oils, but sesame, you will find it in every single Ayurvedic formula, pretty much, for an oil out there. And then I mentioned Vatas Vayus. So this is a really important component of an Abhyanga. We are trying to balance all the Vatas Vayus. So there's 5 of them, and I'm just going to show you this slide. So we have Prana, Udana, Dhyana, Samana, and Apana. And the strokes that we do in an Abhyanga, the choreograph, the sequences, the protocol, all of it, it's done with strokes, as you can see, the directions, right? So we have prana going kind of from into the body and down. And we have Udana going up. So that's the upward movement. We have Samana, which is the centrifugal, like digestive peristalsis force in our digestive area. And then we have Apana, which is going downward. And then Dhyana is coming from the periphery, to the center to the periphery. So in every stroke, in every way that we're touching the body in an Abhyanga, we are restoring and recalibrating the Vayus here. So this is a very, very important component that is important for somebody to really understand and learn. But you can also know that if you have a client that's showing imbalance from any of these subdoshas of Vata, then you can say, okay, so, I want you to get an Abhyanga, and I want them to spend a lot of time in the Samana Vayu and do a lot more work on the abdomen, or, whatever your prescription is, but you can really start to tailor and customize your treatments more when you understand the subdoshas and how to recommend an Abhyanga with more emphasis on bringing balance to that. Also, we're affecting the 5 koshas when we're doing an Abhyanga because, Ayurvedic treatments are inevitably energetic treatments as well. You can't not affect the energy of the body. So we just want to be intentional and aware of what we're actually doing here. And even as just a practitioner who's recommending these treatments, understanding how the Abhyanga can really work to help bring balance to the koshas as well. So these are the subtle bodies, right, that encompass the physical body. And these are the subtle energy fields that surround and infiltrate our body. This is what the koshas are, the 5 energy layers or sheaths. So the spiritual goal, as we know, or as we're learning of Ayurveda and Ayurvedic massage, is to prepare the sheaths and koshas so they can facilitate the flow of consciousness and Shakti, so that's creative spiritual life force and even love that fuels our life. And when the subtle bodies are balanced, each sheath or kosha, so including all the aspects of the mind, body, and spirit and emotions, they can all function to their full harmonious potential. These 5 subtle bodies, they begin with the source of consciousness, right? Our causal body, and then they culminate with the manifestation of the physical body. So we're going from subtle to gross, right? And the goal of Ayurveda and Ayurvedic massage, and especially in conjunction with yoga, is to support and balance the subtle body, so that when an individual begins their spiritual life, no matter what discipline or religion, then spiritual success spiritual progress is being made. And according to Ayurvedic sciences, before one can enjoy all the fruits of spiritual life, then physical health must be restored. So this is part of our dharma as Ayurvedic body therapists. And you know, when you're working with a client, it's not just about the physical, right? We always have to incorporate the spiritual and their energetic components as well. It's all connected. So just to conclude this little portion on Abhyanga, you know, depending on the dosha we are balancing or the effect we're trying to achieve, then the pace and the pressure also do really factor in. So different strokes for different folks, because vatas, so they need, right, their qualities are dry, cold, irregular, rough, and they need to have a massage which is warm and oily and smooth and very nurturing and very light, kind of like a medium to light. Abrupt, rough movements can be irritable and disturbing to vata types. They're the most sensitive, and their bone structure is going to be, and their skin even is going to be the most fragile. So an abundance of warm oil should be used, as well as keeping lots of warm blankets on hand, a warm table. The ambience of the room should be very relaxing, not bright lights, something very ambient and very peaceful. I found that music should be music that's just instrumental. Sometimes, and I read this once, and I find it be true for myself, that the human voice will bring someone out of a meditation or a sleep, even, like more than any other noise, the human voice. So when there's talking going on, or if there's, you know, people saying things in a song, then the vata mind is going to be trying to like listen to that, when they should be trying to quiet their mind, because vatas, as you know, we're learning, they have more of a monkey mind and an anxious mind, and it's kind of a wandering mind. And the whole goal is to help them to ground that mind. You know, it's the air and space in them too that keeps them all up in their head. So our goal as therapists is to really bring them down and ground them. So we want to use ambient music, ambient atmosphere, and try to minimize a lot of talking. You know, maybe sometimes in the beginning they get nervous and they're like, blah, 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 blah. And they want to tell you stuff. And you're like, okay, so now we're just going to breathe. Just take some deep breaths, quiet your mind, you know, and just guide them. They just need to be guided into that grounding energy. And then pittas, they're going to need a massage also that's calming and relaxing. And I've noticed that they respond really well when you begin with a light pressure, but then get to the medium deep as needed and when needed. Too much fast movement can kind of vitiate their imbalance because they're already kind of on the edge. So we do want to help them know that we're in control as therapists, that we've got this, and that they can just really just relax. And that's all they need, is they just need some reassurance that you're in control and that you know what's happening and they're in your hands, like putting them into your hands. And they do, you know, really respond well to that medium firm pressure, because they feel like you've got it, like you're in control, and it just feels really good to them. And then kappas require probably the most vigorous and firm strokes because they have more of a sluggish type of metabolism and more sluggishness in their channels. So we want to use a little bit more of a vigorous kind of a friction stroke. When we do the strokes with them, we're going to use more pressure because they do have more deep-seated tissues and joints. So in order to really work the oil in, and this is again, only if it's indicated, right? Because I talked about how people who might have thicker, denser tissues or have kappa imbalance to the point of being obese, then we're not going to actually work oil into that. We're going to work maybe different therapies, maybe just some teas. But there is another therapy that we would do with kappa, and that is Udvartana. Udvartana is a dry, almost kind of a dry paste of herbs and flour. So it could be a lentil flour, it could be chickpea flour, but what we're doing is we're creating this exfoliation effect. And just like if you've ever done a clay mask or put some clay on the body as a poultice, then it kind of draws out toxins or impurities. And it's the same with Udvartana. The whole idea is that it helps to exfoliate the skin and then draw things out. So opening up the pores and then the herbs, and there might be just a tiny bit of oil in there that just really does help draw things out. Because oil, so the skin, right, it's an organ, right? It's an organ of assimilation, but it's also an organ of saturation. So it takes things in, but it can also bring things out. So oil does have that quality as well. It has the ability to be saturated, but it also has the ability to draw things out. So this is the purpose of Udvartana. And if people have a foul smelling skin, then, due to maybe a lot of blocked channels or ama in their body, then this would be the perfect thing for them, Udvartana. And everybody can benefit from this, a couple times a year or during a PK or any kind of time that you just need some good exfoliation for the skin. So that would be a perfect therapy for a kappa imbalance instead of an abhyanga. Also, what's really good for kappa is Garshana. And this is a really, really beautiful treatment. The benefits actually for each one of these therapies, I could really go on for a couple hours just on each therapy. That's how many benefits and things I could talk to you about, which makes them so amazing. But Garshana it seems really simple, right? It's just these raw silk gloves. And why raw silk? Why raw silk? Why not loofah? Why not, and it's because raw silk has a protein in it called sericin. So that's a protein in silk. Sericin, you can find it in skincare products. It's very common, but it's a protein that is beneficial for the skin. And if you did have some pitta expressions on the skin, psoriasis, it's actually safe to use on that and does help to heal it. It's not like I would be vigorous on it, but I would definitely gently go over it with the Garshana glove. But it's very bouncing and invigorating for kappa types. And it's done with quick friction strokes. With that friction, we're actually causing kind of a static electricity going over the skin very quickly and very lightly with the glove. And that creates an ionization and alkalization of the blood through the static electricity. So it's called ionization. It creates those. And just like, I don't know, a long time ago, there was this huge trend that came through with ions, positive ions, negative ions, and, oxygen bars and all these things. And it alkalizes the blood. It brings oxygen into the blood. The static increases heat, and then the channels of circulation and open up, and then waste removal happens and it gets improved and it helps the lymphatic system. So I really love doing this even before an abhyanga, if it's indicated, because it just makes the skin so nice and soft. And when you put the oil on, it really helps the oil penetrate nice and deeper, and the glide just feels amazing. But with the static electricity, some benefits there are going to be helping with muscle ache and stiffness, even neuralgia, if it's not too painful for them. We are being light with the touch, but it can over time help with neuralgia, fatigue even, and even gastrointestinal function. So how much time do I have?
That's a good
It's-
question. We were just going to let you know around this time that it is 8:41 and we want to leave some time, probably the last 10 minutes for some questions. So if you,
Okay.
we don't have that many in the chat right now. So unless I
Okay.
see an influx of them, I think you can keep going.
Mhm.
I'll just
Okay.
keep informed.
Okay, thank you.
You're welcome.
So then Garshana, so on your own for self-care is great, but so for kappas, they could do it every single day. Those who are predominantly pitta, I would say maybe 3 to 4 times a week, generally, obviously consult your practitioner, but generally about 4 to 5 times. And those with more vata, maybe just 2 to 4 times a week. We already have dry skin as vatas, and we don't really need to, and the movement even can be vitiating to vata. So, just a couple times a week as needed. Okay, so then we have Swedana. And Swedana in Sanskrit means sweat, just means sweat. We do an herbal steam. So if the beauty too is like these therapies can really kind of flow one into the other. You could do a Garshana, you could do an Abhyanga, and then you could do a Swedana. And this is pretty typical for a Panchakarma even. You would get these treatments every single day. Abhyanga, sometimes Garshana, Swedana, Shirodhara, all of it. So they're really lovely. But the Swedana, what it does at the end, especially after an Abhyanga, is this is a couple of different ways to administer it, right? So we have the steamy wonder, which is the steam tent, and this is what I personally use. It's what I learned with. It's very, very easy to just lay it over the table, and then there's a that goes down onto the floor over a steam kettle that would come up over the body and provide the herbal steam over the body. In India, they usually use these a lot, where there's a steam box and you can just climb yourself into that box after your massage and sit there. And it's nice because the head is out, and we do want the head out. We don't want the head getting overheated. And even during a Swedana, it's really important for the therapist to be keeping the heart and even the nabi center cool with some cold cloths, and just protecting those very sensitive areas of the body. A kappa can endure it up to about 20 minutes. If the more heat, really does also help that kind of gentle detoxification, helping to deliver those toxins to the GI tract that the oil has collected. So this is part of how we get it to the GI tract is by giving this heat. And that's why if you've heard of doing an Abhyanga on your own, then you would do it before your shower, putting on the oil, and then getting into a shower or bath to create that sauna effect and that heat that really opens things up. The temperature, and then for a pitta, about 5 to 10 minutes. You would also, as a therapist, be wanting to check their pulse and just making sure they're not overheating in there, because that would just completely, be a disadvantage to anything we're trying to balance. Okay, and then quickly, we have Shirodhara. So it just means to pour oil on the head. Very, very, very profound for recalibrating, resetting the nervous system. Any kind of nervous system disorder, anxiety, depression, any kind of, stress factors that we're dealing with, very cleansing effect on all of that. Anxiety, fatigue, hypertension, chronic headaches, depression, regulates mood, really balancing for people with PTSD, even like those. It really helps to reprogram the brain, especially if we're doing it consistently. So we're doing it daily, and we're getting into this brain reprogramming, because if you see, so the oil is done in patterns over the forehead first, and this is bringing the whole brain into a deep theta state. And then when we get it resting on the third eye point, this is a strong Marma point, strong energy point here that is going to deepen that theta state. And that's what recalibrates the nervous system. The person will feel like they're just going in and out of consciousness. And it's so resetting for the body, even for a deep, deep rest. The person will feel like they've had such a deep rest, and it's rejuvenating in that way. And that's definitely the effect we want to create, is rejuvenation. And it does produce hormones. It activates the pituitary, pineal, hypothalamus, which not only, regulates the hormones in the body, but if I had more time and we got deeper into it, I could tell you that this is a very amazing tool for advancing spiritual progress as well, because of the way it works on the nadis and the chakras also. Any contraindications for that would be mostly going to be acute. We can probably intuitively understand that we wouldn't indicate a Shirodara if somebody was presenting with any of these things. Again, I'm going to give you all the slides, so don't feel like you're going to miss out on any of this stuff. Yeah, so that's pretty much the same. So I do want to open it up, but I'll just mention we do have the Do Bastis here, which can be done on the heart, can be done on the knees, the lower back, the back of the neck. The Shirodara, you could say, is a Basti for the head. We can also do it on the hip in a side lying position. And it's just a beautiful, beautiful treatment, especially even for the eyes. So we would call it eye bathing, a Netra Basti. This is really one that you could probably, if you could find a therapist, actually recommend easily, because it's just so rejuvenating for the eyes. And we're all on devices and all the time, and even the environment. We might live in polluted areas or in environments where our eyes really dry out or get irritated. So doing an eye bathing Netra Basti treatment is amazing. It really does help with the optic nerve. It does help with the muscles of the eye. So if somebody has cross eyes, it can help correct that after several treatments. So the benefits can go really very clinical, or they can just go very simple. Like, I just put castor oil or ghee in my eyes every night and just rub it into my eyeball. And then I wake up in the morning and wash it out. Or you can use rose water eye wash in the morning to help blink that out. And that's a very, very effective treatment for just dry eyes. If your client's like, oh, my eyes are so dry, I use eye drops all the time, then you just say, oh, let's do ghee, let's do castor oil, and just put it in our eyes at night. And using rose water, you can just even spray it right in your eyeball instead of eye drops. And it's cooling, it's hydrating, and it's anti-inflammatory. So rose water and ghee or castor for the eyes and the eye bathing. I'm a big fan of that. So we could definitely get into a lot more. There's Pindaswedana, which is the bolus, herbal boluses that you can put on the body after an Abhyanga. You could do it after even one of these, a Vishesh and Pizza Chili. This is deeper, kind of more Panchakarma treatments with a lot more oil, a lot more heat, and even 2 therapists working at the same time. And then we have ear oiling. So this is really effective and really simple, but just make sure it's indicated properly. And it can help with relieving earaches, hearing loss, tinnitus, which I help a lot of people with, headaches, lockjaw. So anything, especially any kind of tension in the occipital region, the neck, the head, putting oil in the ears, and even in the nose, because let's not forget nausea. I'm a huge fan of nausea. I love this on myself, and my clients love it. So really getting oil up into the sinuses, clearing the gateway to the brain, bringing the herbs. So you would want to get an herbal formula of a nausea oil. I really love Banyan's, and I really love Dr. Ladd's from the Ayurvedic Institute. Both formulas are incredible for not only nourishing the sinus canals, but also getting beautiful, lovely herbs up into the brain for enhancing cognitive function, for helping the nervous system, for helping any tension and tightness, and even for promoting mental clarity, which can help with meditation. So again, there's the physical, and then there's the spirit, and then there's the mind that we're all working on at the same time. So incredible things with nausea, especially because it doesn't have to go through the liver. Like you're definitely just bypassing that by bringing things right up into the brain and into the nervous system. So I know that if anybody is suffering from loss of taste or smell from COVID, this is what healed me. And I did help with lots of clients with that as well. So restoring natural hygiene and smell and taste in the mouth. And then last but not least, we have Marma points. So Marma are vital energy points, 107 in the Sushruta that are mapped out on the body, and they connect directly to the nadis and then the chakras and then into our causal bodies. So they are a point system that work with our nervous system. They actually have a great affinity for the mind and the nervous system, but they also correlate to organs, and they are they're just amazing for everything, especially for people who maybe are not open to receiving other body therapies of Ayurveda because they don't want to be covered in oil, or they don't want to be, doing all these things that seem very strange to them. Marma can be the answer to all of that. You can say, just get a Marma because it's very gentle. It's like a Ayurvedic acupressure. We're working on the point system. We're doing some energy work with the pranic healing, and Marmas are pools. They're spaces. They're points that hold prana.
Beautiful. So we're at 8:52. Do we want to start opening this up to Q&A?
Is unlocked in the Marma.
Oh, she's cutting out a little bit.
Did I cut out and you didn't hear my whole thing about the Marma?
No, we heard it, and it was just a small, brief moment, and then I kind of interjected and noted the time and thought it would be a good time to transition to the Q&A. So we have it's 8:53, so we want to maybe transition now. Okay, so there are a few questions in the chat box. I'll start. The first one is, how does it work? How does it work as castor oil is very thick and sticky and can constrict the massage strokes? Do you add something?
Yes, definitely. Yeah, you would probably use a third castor with the other oils that you would use.
Awesome.
If you want that much. You could dilute it even further if you just want to add just a little bit. It totally depends on the indications.
Okay,
yeah, I would mix it.
The next question is Pinda Sveda the best body therapy for sciatica?
No. It can help for sure. It definitely brings relief, but I would say Marma and actual like Vishesh or deep tissue massage, even a Thai massage where you're getting some stretching, because sciatica is a pinched nerve because of a tight muscle that it runs through. So yes, all of these things can help, but what if it's an advanced form of sciatica, they're going to need some really deep tissue massage work.
Thank you. And then the next one, sorry, I had it and lost it. How long would you do Svedana for Vata?
Vatas are usually run cold, so they can go up to 20 minutes, but I would just check, or have the therapist make sure that their pulse isn't racing. We don't want to cause their pulse to race. We don't want them to overheat. We just want them to get warmed up enough to create the therapeutic effect. The Vatas will stay in there all day. They'll be like, oh, I'm good, but you're like, no, actually, we got to stop. Oops.
Can a hot or warm bath be substituted for Svedana? And if so, how long should the client stay in the tub?
Depending on the temperature of the water. I don't see a steam is a lot more potent to deliver heat than a sauna or even a bath. Like this, when water is heated up and put into a steam, it delivers deep into the body about 25 times faster and hotter. So for a bath or a shower, it's not going to create that intense steam and heat than if you were in a steam box or a steam tent. So it's much safer. So as much heat as the body can stand is probably sufficient. And then I would just say, 20 to 40 minutes. My teacher told me that 48 minutes is the maximum amount of time your body can soak something in that can be saturated. After 48 minutes, it's not taking anything in anymore. So I usually tell people, between 20 and 40 minutes, 48 minutes for the bath, or if they're having like a herbal bath or like a Epsom salt bath, a detox bath, 20 to 48 minutes.
Beautiful, thank you. Which oil is used for Shiodara?
Sesame is used, and then there's people who make Shiodara oils that include herbs like Brahmi and calamus. These two are very well known for the nervous system and the mind, calming and balancing and grounding. And then, there could be other things, like I've given Abhyangas with as referrals for ashwagandha bala. I've given them with tea for kapha people. I've done tea. For pittas, you could even do a milk, because milk can be cooling with some herbs in it. So, it just depends on what the therapeutic effect we're trying to bring balance to.
Thank you.
But the most common, if somebody I didn't have a consultation with just came up and wanted to book a Shirodara, then I would probably do the sesame Brahmi. And then there's a lot of Ayurvedic companies that already have formulas made for you. But just sesame oil alone is very, very nourishing and grounding.
So we have a question from the audience from Mira. If you'd like to unmute yourself, Mira, and I see your hand is up.
Yeah, I wasn't sure where to write my question. So for tinnitus, which is so prevalent right now, what kind of oil would you recommend?
Mm-hmm. Yeah, even sesame oil, again, for that ghee, if it's indicated, it depends, on your client and what their constitution is. But I've also made an oil with just a sunflower oil as a base and added tea tree and lavender to that. And that even helps with any kind of bacterial buildup in the ears. The tea tree would help with that, lavender too. But it also depends on the therapeutic effect you're going for, right? That's the famous answer in Ayurveda, is it depends. And maybe we're oh, but you said tinnitus. Yeah. So the lavender would be really good. Tea tree for sure. So I would recommend that: sunflower, lavender, tea tree. But just, if the client has a constitution that you think that would not be indicated for, then maybe just do a little more research on that.
What ratio would you say?
Oh, so I would do drops. I would do maybe in an ounce of oil. So you can make your own dropper bottle, right? Maybe you do 4 ounces of oil, and then I would do 5 drops of each in that oil.
Oh, okay. And how about garlic in sesame oil? What do you think?
I don't know about tinnitus. It might be indicated. I know, like, if there's an ear infection or in that realm, garlic for sure. Garlic and mullein. Mulleine's an herb that's very effective for the mullein flower. The flower of the mullein with garlic in an oil is very effective for ear infections, especially in children.
One
Okay.
last question from the chat. About the dry eyes. They're asking, are you putting the ghee and castor oil into the eye or just rub it onto the eyelid?
Yeah, so I guess it would just have to be what you're comfortable with. Some people are like, I don't know if I can open my eye and actually just rub this into my eye, but like if you put it on the eyelid, it's gonna soak in. So that's one way to do it. But you know, because I'm more comfortable with it, I'll just literally just stick my pinky and I'll rub it into the corner, but I'll actually go along the inside of my eyelids as well. Oops. Because I really want to get it in there. You know, I
Right.
do have lots of dryness, so I'll literally just go for it. You can get a little eye cup, which, you know, shaped like a little champagne glass or whatever, and it's contoured to the eye socket. You can get those on Amazon or wherever. And then you could put the warm ghee in there or the warm oil, and you literally just do like an eye wash with the cup from the oil. If you want more going on, I've tried it with ski goggles. It was a little messy, but it did kind of work. But it's messy, so I just kind of rub it in with for my eyes anymore. And if somebody's not comfortable with that, then just have them do it over the eyelid, and it will soak in. And then hopefully over
Thank you
time
so much for that.
yeah, hopefully they'll just grow to love it because it's so relieving. Yeah.
Awesome. I think that's all we have time for this evening. It is 9:02, unless there's any pressing question before we close out our meeting this evening.
I want to make sure that people see the screen right now because that's her her website. And of course, if you get that screenshot, you can buy one course and get one free. So
that is the special for all of you. I do have all the courses on sale already, but if you wanted to learn both, then you could buy one, get one free, and that's just for you because I know you're all students, and so we can all use the discounts. So yeah, you can find that on the website, and those will be good till September 15th. But I am going to give you all, actually, let me put these in the slide before I forget. And if anyone has one more question, they can ask while I'm doing that.
Do you have it PDF'd already?
I do.
Because you're Seva. That's awesome.
And I'll just stick that right there, and hopefully everyone gets it. If not, just send me an email. I'm happy to send it to you.
That and the learning management system, when you get it up on when you post the video or the recording of this session, then it'll also be there. Very good.
Right.
Oh,
well,
I
hope you understood. I went through that faster than I ever have in my life. But you know, it's such a passion, and I love talking about it. So if anybody wants to learn more, just let me know. Or a resource where you can learn what you want to learn, and I'm happy to help you find what you need.
Very good.
Thank you so much.
You're welcome.
Thank you, Seva. That was amazing.
You're welcome.
And I learned so much, so much. And so did everybody else that's in the chat. And I'm saying thank you. So that is wonderful. We really appreciate it. And I'm so glad that you were able to join us. Melissa, Bella, do you need to follow up with anything?
No, just thank you so much for all of the information, Seva. It's appreciated.
You're welcome. And so much good luck to you and as you complete your programs. And hopefully you you go on to become amazing professionals and community members and leaders and ambassadors to these amazing things. And hopefully, you know, if you don't already have a therapist near you, I'll grow this. That's my mission. I'm going to grow it. So there is a therapist near everyone. Yeah.
Thank you so much.
You're welcome.
All right, thank you. All right, bye-bye.
Yeah.
Thank you. I'm signing. I'm going to give it a moment. Thank you all for joining us. It was wonderful. And I will submit PACE credits for those professionals that have requested it to Saba within the next 2 days. And it should be up shortly for you. Okay. Anything else? I'm going to go ahead and end the session. So thank you, Melissa. Thank you, Bella. You guys, you're not a guy. You ladies are rocking it. So thank you so much. And if there's anybody else left on the call that would like to join the student subcommittee, reach out to me. Alrighty. Thank you much. Talk to you soon. Bye-bye now.